Well, more than 13,000 women are diagnosed with cervical cancer each year, but rates are dropping, and that is thanks to early detection and regular screening.
January is Cervical Cancer Awareness Month, and UI Health is helping women throughout all stages of cervical cancer screening, diagnosis, and survivorship. Dr. Priyanka Gokhale joins us with more. Doctor, thanks so much for being with us.
Thank you so much for having me.
Okay, so cervical cancer, where do we need to start? What do we need to know?
I think the most important thing I want women to know is that cervical cancer is preventable and we can catch it early.
Okay.
When we say preventable and catching it early, this is something that you should be doing every year at your appointment, like with a pap smear, or how are we doing this?
Yeah, so prevention to me starts with getting the HPV vaccine if that's something that you're eligible for. So most cervix cancers are actually caused by the human papilloma virus, or HPV, and we have a vaccine that can prevent you from ever getting that virus.
And when we were growing up, of course, the vaccine, the HPV vaccine did not exist yet. But now there are recommendations for parents to make sure that their kids do get that, right?
Exactly. And if you haven't gotten the vaccine, but you're under 26, we definitely recommend still getting it. Between 26 and 45, that is a consideration that you can make with your doctor as well.
And then let's talk about anyone who's over 45 at that point, if that is not a recommendation at that point?
Right now, it's not approved for that age group.
Okay. And so then at that point, what would be the best way to be screened, to be tested, just to make sure you're doing everything right?
Yeah, so for patients over 21, we always recommend coming in for your routine cervical cancer screenings, which is done via pap smear.
And of course, that applies, the pap screening for women. But I did want to mention for the vaccine, though, you recommend that both for boys and girls, right?
Exactly, yes.
Okay, because a lot of times people don't even realize they have HPV, right? Because it presents in some people and in some people it doesn't. Can you tell us a little bit about it?
Absolutely, yeah. So most people don't know that they have HPV at all unless they have some form of testing, like with a pap smear.
What are the symptoms for cervical cancer if you are worried that it is something you may have, or are there any?
Oftentimes there really aren't any. Sometimes women come in with bleeding or pain, but I would say for the most part, people don't know.
So without the screening, you're kind of stuck.
Exactly,
Yeah.
so really important to get those pap smears, annual exams, and also just listening to your body and going in if you think that something feels off.
And for women who unfortunately do get diagnosed with cervical cancer, what are some of the new treatment plans that you have?
Yeah, so it really depends. If we're able to catch it early, you can have pretty non-invasive surgeries. Other women do require hysterectomy, chemotherapy, or radiation.
Okay, and over at UI Health, you guys have all of that available to patients, I assume, and you walk everybody through the entire process.
Absolutely, yeah. We have doctors, midwives, nurse practitioners who are all helping to take care of patients.
And of course, you always have innovative research happening to hopefully advance the research as well.
Absolutely.
Incredible. All right.
Well, we
That's
appreciate
great.
you being here. Thank you so much.
Yeah, thank you so much for having me.
For more information, all you have to do is scan the QR code. It's going to come up on your screen. You can head to uihealth.care, find them on social media, and get all the information you need.